Hello and welcome to the Days of Learning podcast, the podcast where we discuss health, wellness, medicine, community engagement, and health promotion. Days of Learning is sponsored by the Center for Disease Control and Prevention, the Wisconsin Department of Health, Milwaukee County organizations promoting wellness, and Medical College of Wisconsin. I am just so excited to have this guest on. I have known Jane Danforth for going on 20 years. Welcome, Jane Danforth.
Hi, David.
Good to see you. Jane and I have worked together way back when. We started working together when the tobacco settlement monies came out in 2000, and Jane and I have been working together since then. Jane is the Director of Grants and Community Wellness for Millinocket Regional Hospital in Millinocket, Maine. She has her MPH from the University of New England. She has a master's degree in special education and a bachelor's degree in psychology. Jane, good to see you.
It's very good to see you, David.
You know, and we're going to talk about infrastructure. Much of the work that we do here around Days of Learning focuses on Wisconsin. And Jane and I were talking about how similar the state of Maine is to Wisconsin. There are these urban areas, there are these suburban urban areas, and then there are these rural areas. And where Jane is located, if you can picture the state of Maine, it's right in the middle of the state. Most of people that when we hear of Maine, they think of lobsters, which we do love our lobster boils. But much of Maine that I know and that Jane is a part of is not the coastal area, but is what we might consider the North Woods, where much of the area was built around paper making, around lumbering, and more recently has turned towards recreational, as well as the idea of being a community where people have long-standing members. For those who are familiar with the outdoors, Maine and Millinocket is the terminus of the Appalachian Trail. And if you're familiar with that, we know that ends in Mount Katahdin, and Mount Katahdin is literally in the backyard of Millinocket, and you can see it from many points of the community. Jane, tell us a little bit about who you are and how you got to have the position you do as this Director of Grants and Community Wellness.
So I am actually a lifelong resident of Millinocket. Was born here, went away to college to get my degree in psychology, came back home, got married, started a family. And then I always knew that I wanted to work with people, didn't really know what that was going to entail. So hence like my degree in psychology got me started. When I came back to Millinocket, there weren't a lot of opportunities, or I guess I didn't know what there were for opportunities working with people. And my first job was actually with a preschool. So I went back to school to get my degree, to get my teaching degree, and to get and actually eventually my master's degree in early childhood. That's when we met, 2001. I was finishing up my degree. If I remember correctly, you were finishing up your doctorate. You had the job, you worked for the hospital overseeing the fitness center. We met in the fitness center. You just talked to me, we struck up a conversation on several occasions, and you had just received word of the grant award for the hospital, the tobacco settlement money, and you encouraged me to apply. So
I remember it well.
Yeah.
It was like it was yesterday. We had that big old fat RFA, that request for proposals, RFP, and we put in our application, and we've been working on this stuff with the community ever since then.
Yep, so that was in 2001. You hired me for the hospital. Quickly realized I needed to learn about public health and got right back to school, and worked on my degree for public health in 2010. Got my MPH. So yeah, since 2001, have been doing community coalition work in Millinocket. Thanks to you, got me started, got me hooked.
we'll talk about that later about, where to send the bill for that, for the therapy I'm doing community health. No, I'm kidding. Jane, I want to talk about something that you mentioned early on, that you're a lifelong resident of this community. Tell us in your own words how that has supported the work you do.
Well, you quickly learned when you moved here, if you're not from here, sometimes it takes quite a while for, to get some credibility and for people to accept you because you're not local. So I guess, and I think you actually recognized that when you hired me, you need somebody from here that knows the community and knows people. So I think in this instance, working in rural community, just having that familiarity, people knowing you, it really helped me get started and helped with this work. So it's just, it's one of those things, being from here, knowing the community, knowing, having connections already, the different things that I was involved with, at that time, probably being a young mom, the church, just the social fabric of the community. That certainly was an asset and a benefit.
What does it mean to know the community in that instance, Jane?
Well, sometimes it's knowing, sometimes it's like knowing people, like who are the sort of, which you would say maybe the shakers or the movers, or who get things done. Knowing sort of like the needs. I don't know, just the ways. Every community has a different culture, how to get things done. So it's just it's sort of a, when you hear the term cultural sensitivity, I guess it almost in that sense, it works this way too. And so that when you're doing things, you're community based, not community placed. You're just like, oh, you think you have a great idea that, everybody's going to love this. You've got to come from the lens that you're going to be community based and work from the ground up, not place yourself in the community and just expect everybody to accept you and one of the things you suggest.
You could have that great idea and nobody showed up, right?
Mm-hmm. I think we
And
did
even
a few times.
Yeah, we have, haven't we?
Yeah.
What's the difference then about the idea of community-based from your perspective?
So community-based is actually actually what? So maybe the ideas actually come from community members. And maybe you've planted seeds for those ideas, but people latch onto them themselves, or they come to understand them. It's just community place. I see that as you're telling people, here's what you need. I see this need. There's this crisis. There's something going on. This will fix it. It's community-based. People are coming up with their own solutions. What works here, what we have the capacity to do, and what will last. Because so many things community place, once the funding goes away, once the people driving the initiative or what go away, those dissolve. A lot of times the programs go away. So
yeah, so we would call that the idea of having that buy-in. And we study the idea of the science of community engagement, and we know that we have to listen to the needs of the community. We have to understand that culture and have that sensitivity, regardless of it, if it's based upon the idea of the orientation or the ethnicity or any number of factors. And if you don't do that, you run the risk of nobody showing up. I would even actually add that you even run the risk of alienating people depending on what you're trying to do. Would you concur with that?
I would absolutely concur with that. Yeah.
So that is a phenomenon that we need to take note of. As much as we can, we want to get down to the level of the people. And I think it helps. I remember several times when Karen and I were part of the community, Karen would go to the grocery store and people would say, wow, you actually shop? And then secondarily, people would want to show Karen things. And she said, nope, I don't want to see that in the grocery store. We could make an appointment to go see that.
Yeah. Yeah. I remember having similar I guess interactions in the community when I first started the work, obviously, because it was tobacco settlement money and we were trying to prevent and reduce tobacco use and deaths related to that. I was the tobacco lady. So for
Mm.
the longest time, people would see me, yeah, oh, that's the tobacco lady. So I, sort of that was placed upon me. And so it took quite a while for that, what I've been in this 19 years. I probably hear it once in a while now, but not so much anymore, but first just get sort of labeled until people understood there was a little bit more to it than that.
Yeah, and people at the time, this was a pretty landmark decision in that the tobacco companies were paying out vast amounts of sum of money in order to settle the lawsuits that came against them because of the product that they were developing. Many states did use it to plug shortfalls, and Maine led the country in using the money around prevention. Now, even that had its controversies, didn't it, Jane?
Yeah, it did. And that lasted for a while. I don't know, maybe for like 8 years, as far as the money being spent the way it needed to be. And that had to do with the administration at the state level, because things changed when governorship changed over and stuff. So we actually lost a lot of the tobacco settlement money that we were working with for local public health work, and the structure at the state level changed. So when we started this work in 2001, it was for the purpose to create these local Healthy Maine partnerships. So they were very local, grassroots level work being done. And then I think it was in 2008, it shifted into districts. So a lot of the funding didn't go right to
Mm-hmm.
local municipalities. It went to public health districts. And so where we live in Millinocket and Penobscot region, we became with Piscataquis County and Penobscot, Penquist Public Health District. So structure change went up to a higher level, and so we didn't see as much money at the community level.
Yeah,
More,
and for our listeners who are not familiar with that terminology, these are just communities in the region, and some of the distances can be, 30 to 40 miles between communities, and so it's not like we're popping over from one suburb to the next. Though we have some of that in where you're at, but it creates some distance, and it's a physical distance, and there's also a cultural distance in some of these
yeah,
communities because of the varying needs of those communities.
that's
And
exactly.
go ahead.
Yeah, no, that's exactly right. Because our next, largest community of service or to go is Bangor, that, like 70 miles, down the road. And so we always locally, we have the saying, we're not Bangor, because so much money would be funded to that region and it never would trickle into our community. So we're always feel like we always have to be at the table and sort of fighting for it. So luckily, I guess I'm part of the district, the public health infrastructure, and sit on the district coordinating council for the Penquist district. So even though, I'm represent this area. So whenever there are opportunities for funding to come this way or services, at least I can, sort of raise my hand or rattle the cage a little bit, and don't forget us, here as well.
I can attest that Jane Danforth would be one that would rattle the cages, if you will, and I know the family well, and they're not shy
Yes.
about doing that. But it makes a good point, Jane, to say that if we don't have representation, you run the risk of having things be co-opted by people who frankly don't understand you.
Mm-hmm.
And I want to say something, because when we started this work around changing norms and standards, as we used to call it, around the community culture, and Jane, known as the tobacco lady, it was, in many cases, it was not a term of endearment,
Yeah.
because we came from a manufacturing community, which as I don't even remember what our numbers were, but we had a large number of people who were smokers at the time. And we were the first state to enact the restaurant laws where smoking was banned from restaurants. Do you remember that?
I do. Of course, that was glorious for glorious for us. But yeah, that was controversial because there used to be just smoking sections. You could be in the same physical space, and these tables over here were smoking, these weren't. So you really weren't protected. But it sort of happened in phases. But
We're old enough to remember smoking sections in airplanes, and that
yeah.
didn't work out so well either. Jane, I want you to, we're digressing. I'm not even getting to the questions, but that's just how it goes. Um, Tell our listeners about your community.
So you gave a really good, you started off to say Millinocket, if you look at the state of Maine, you look at it and you just point to the middle, but basically Millinocket is in the center, a little bit north when you're looking at it. And you have to go through Millinocket to get to the base of Mount Katahdin and Baxter Park. So we consider ourselves rural. Our population right now is right around 4,200. Used to be back in the heyday when you talked about the mills, up and operating, I don't know, maybe 3-4 times that much. I'm not even sure now, but it really has, it has dwindled, would you say, down to around 4,200. And because I do some work now, age-friendly community work, I happen to know the statistics. So about 36% of our population are over the age 60. So we are an older community, and Maine is known for having the population of the oldest in the country. So Millinocket, so that our demographic now is of the older cohort, would you say? I was actually just looking at some school data, and we're down to having only like 500 students in the school system. So population wise, that sort of give you an idea of like the school age population. I don't have the breakdown of our, the rest of our population, but, and I was looking at our, our median income levels are right around 45,000. Right now our unemployment rate is at rate about 12%. And I think in January and before post-COVID, it was around 8%. So our community has changed a lot. Since the closing of the mill, the industry left. We used to be very, very prosperous, and now we're sort of at the other end of the spectrum and trying to figure out how to live that way.
Jane, you had mentioned that at one time, and I want you to, we understand in the Midwest where this show is coming from, the decimation of industry, whether it be auto, or in this part of the country, the beer companies that were involved in Milwaukee. But Millinocket was known as the Magic City. It literally grew out of the woods at the turn of the 20th century around paper making.
Mm-hmm.
You grew up in that era. Can you talk to the listeners about the community in its glory days, or as they started to decline when you came as from a child to an adult?
Yeah, so I hear all the stories about glory days, and I grew up, I guess, in those glory days because my dad was a manager for the paper company and middle income. And there was a time, I guess, our town budgets, they didn't have to worry about shortfall because industry would pick up or fill in fill in where funded was needed. Used to hear that at the hospital as well, that never had to worry about their budget. If anything was needed, you could go to the you could go to the, I say mill in general because there's several different, different owners or whatever, but there was funding there. We never had to worry. And because we're such a recreational community, folks had, seasonal recreation, whether it was a boat, snowmobiles, all the different sort of toys that you could have for outdoors. So people worked hard and played hard. That was sort of what we always understood this area to be, and didn't have to want for anything, from what I understand. And growing up here, I felt very fortunate too.
To go from 12,000 and its in its prime to around 4,200 is a dramatic decline in any one lifetime. When I was there, we had the first of many major shutdowns. Can you tell the listeners what that was like?
So for the mill to shut down, it was the biggest employer, for people to lose their insurance and not have insurance coverage. it was really hard. And when you say, I'm trying to put myself back in that place at that time, because people are still learning to live with a mill being closed. We never knew what it was like in this area, I guess, for folks to live in poverty or to need or not have what they needed. So when in a lot of conversations I have, people, I know people in general are proud and they don't want to ask for help. It seems like it's even, I don't know if it could be true, harder here for people to ask for help because they never used to have to, or have to use the social services that were available or any other sort of safety net. So our community culture has changed. A lot of people had to leave the area for work. So people had to go back to school to get retrained. So we had a big influx when the mills closed, and some people stuck around for a while, thought that there was going to be someone that was going to buy the mill and come back and open up and it was going to get back to the way it was. And some people, had to get retrained, they left the area. So a lot of the reason why our population had declined was because, people left the area for work because there's no longer work here. So our community looks a lot different.
How does that influence the morale of the community?
I will say it's getting better. So the
Mm-hmm.
morale, it got very low. I think we went through all the stages of grieving, and we have some new folks. We have some new folks in town. We have people that moved back here, saw promise here, thought this is a great place to live, and wanted to be here. And there are people that were stayed here. And it's taken quite a bit of time, but we've got a real cohort. We've got lots of people here now that see the future for us here. They see diversity, knowing that we can't be this just, a manufacturing town, a one-horse town like we were, with the mills, and are just thinking outside the box, like other communities, across the US. We're trying to make sure we have broadband here so people can come and this can be a destination. They can live here and work from their homes and be connected to the rest of the world. With that, and broadband for telemedicine and that sort of thing. Recreation, we want to be a destination, a four-season destination, and we have a lot of innovative people that are thinking outside the box. The mill site, which was decimated, and now the town does own it, and they've got some funding to rebuild the infrastructure there, water, sewer, get the rail going, and so there's some good things on the horizon there to bring other industry here so that we can be very diversified. So,
There are places, as you said, across America. I think of in Milwaukee here, where this show is based, that we have converted our brewery area where Miller Coors is still in town, but Pabst and Schlitz, and they've converted those centers, which were once manufacturing, into something other than that, whether it be offices and or other type of industry. And I think Millinocket is no different. And what I will say, compared to many of the urban areas, is the beauty of the region. I remember one time when we had our wellness center, and I don't know if you remember this, but I was in my office and I looked out the window and a moose was literally walking down the street. Do you remember that?
it happens once in a while.
It was a baby moose. It was like, hey, look, a moose walking down the street, and it walked into the woods. Talk to us about the beauty of the area, because that, we want to recognize the challenges, but we also want to highlight the assets.
You're absolutely right. And like you said, people come here to see moose, and locally it's like, we don't want to see the moose because usually it involves like a car accident, on or something, and someone's gotten hurt. But just I'm going to stop and pause and just say that I'm guilty of probably taking it for granted, because I see it. I can see the mountain every single day, if I wanted to, if I drove to, down the street, and I can look and see the mountain. So I sort of take it for granted, but we've got this, we got the beautiful outdoors, whether it's, our rivers and our lakes, places to go hunting, rafting, fishing, anything for the outdoors that people want to be involved with, come here and get away. And there's lots of it. and I know that's part of the industry that's tried to be, being built here, maybe some off-road, whether it be ATV, motorized trails or hiking trails or even mountain bike trails. So there's lots of things that are being developed here related to what we do have for the assets out here. And you talked about the mill site. We still have our local, the assets that were here, the wood basket, you hear people talk about the wood that's still available here for all the, that sort of industry. So, and we're right on the river, there's a data center potentially looking to come and locate here because the water as a cooling agent to keep the data center the temperature it needs. So there's all kinds of really cool, innovative things. And, the land to be able to have, huge community greenhouses and, and then to be able to have community gardens available to then assist in our community too with our own local food source. So there's lots of good things happening here.
I will
And
say the
beautiful.
most beautiful rivers in the country.
Yeah.
I'm going to offend somebody, but I don't care. The most beautiful rivers in the country are in the state of Maine. They
You
are
can say
just,
that you lived here.
they are phenomenal. And the recreational opportunities and the business opportunities, because I know many people have taken advantage of the business opportunities. But Jane, because of our long-standing relationship, I think what I know, not think, I know I miss the most, and I want to hear you speak of, are the people. Talk about the people of your region.
So as I had mentioned, our community is mostly of the older population now. The people of our region, we are some of the most stubborn and proud and resourceful people, I guess, because any of the work that I do in public health and trying to make people aware of local resources here, whether it's for, our food comfort, food or our food cupboards or transportation or whatnot, everybody said, well, that's for somebody else. That's not for me. That's somebody else that needs it or, needs it more than me. Our so go ahead and redirect the question. Redirect, you help me out, it's, I think it's one of those things
I can do that. I wasn't leading the witness, but I kind of was.
I know I'm
I
so
love,
close to it. I guess I'm so close to it, and the people, it's like,
yeah,
well, what do you want to
you use the word stubborn,
ah,
proud, resourceful. And I will also say this, kind and giving.
yes,
Um,
absolutely.
in our area, there's a lot of French lineage, which and there's a lot of culture that comes from French Canadians in the region. But the hardest working, and I think of all of the families, for those who aren't aware, the families that came to this area, they came from Canada, they came from Europe to build the paper mills. And so some of our people are first generation, if you will, and they literally grew up in this, and there are families that grew up in the house they were born in, and some of those people still are in that area. But I remember the kindness, even for me being an outsider, and how giving people were. Jane, I'll give this. I want you to speak of the giving nature when we developed our first coalition.
Whoa, yeah. As far as people willing just to come to the table.
There.
Yeah. And you know what? It really comes down with just being asked, having that, just asking folks. I find that a lot in the community work that I do. If you put it out there and you say, oh, we're going to start a group, we need, ask people to, we put out a blanket invitation for something. I will tell you, a lot of times people don't show up. It's almost, they need that personal invitation to come, and it's like, oh, and then once you extend the personal invitation and you tell them why you want them there or why you think that they're important to the fabric of whatever it is that you're doing or the importance of it, they show up. So we have a lot of people in the community that are willing to help out. They just need to be asked and specifically, give them a specific task. Don't have so many that will just want to stand up and take over or take the, sort of lead the charge. But we have a lot of people that are willing, like you just said, they're kind, they'll step up, they'll do what's needed when asked. So
Yeah, taking care of their neighbors. And I remember
Mhm.
when we did this, because we would have representatives from the paper mill, and we would have
Yeah.
representatives from the volunteer organizations and the fire department and the physicians who never had enough time, but they would show up when asked. And literally neighbors helping neighbors.
Yeah. I think that's been the success, and not that I'm trying to pat myself on the back, but just trying to find the recipe for success around the coalition work. It's because of the relationships that we've been able to build, that I've been able to build with folks. And then once they come to the table, they're around there, they meet somebody they didn't know. And then, a lot of the work of the coalition work, the best work is done, when we, say meeting adjourned, so to speak, or we're done. And, in the 10 or 15 minutes when they're trying to make their way out the door, because people like, oh, I need to talk to you, don't leave yet. They'll learn something that somebody else is doing and want to connect. So there's yeah.
I want you to talk about, because I'm going to say in my 22 years of doing this type of work in the region, nobody did this better. Your engagement of youth.
My
Talk about
engagement.
that.
Yeah. So, well, I guess luckily, initially it was all started because we had the funding when we started in 2001. The way the structure was set up, you needed a community partner, you needed a school partner. And part of the, the agreement with the schools was to start, youth action programs, and they changed the names over the time, but it was some of those action programs, youth advocacy programs. So we did have a lot. We had a very successful locally because we got the right people involved, involved the schools and those people in the schools that were real leaders, and the phys ed teachers, or we involved the right people that had the same drive and desire and excitement around the work to build youth leaders. And there was funding available for their training. There's local Maine Youth Action Network. And so there was an infrastructure in place, David, when we first started that made that so successful. The initial vision of the community coalitions and getting all sectors of the community involved, and especially the youth. And so it was not my doing. It was because we had funding, we pulled the right people in, and we were able to perpetuate it for quite a while. And I will say, even after some of the original funding went away, I was able to find other funding to keep some of those folks, that school-based folks, involved for quite a while. And it actually did sustain when some of the funding went away, because the youth leaders in the school just, got so much from it themselves and saw the, some of the great outcomes. Some of the youth really did go on to be leaders, be social workers, and and became staff of Mayan, the Maine Youth Action Network and stuff. So
So our lesson in that is, as we talked about early, not only knowing the community, but I remember it now, man, those kids have now grown and they're leaders in their own right, but it wasn't coalition to youth. It wasn't parents to youth. We called it Y to Y. What was Y to Y?
so it was youth. Why do I was youth to youth, right? Yeah,
Yes.
you're quizzing me, and you're right. Yeah, yep, youth to youth. Why
So
do
it
I?
was this youth that helped their own in the space of
Yeah.
how do we change the norms and standards of school and community of that next generation, and you only do that by having something relevant to people or that are in that group.
Yeah. I found some pictures of back in the day, the why do I, and I will say, one of the great success stories, actually our town, we have a town councilor, the town chair is a young man that used to be in part of the why do I way back. I found some old photos of him being involved in that. So yeah,
Wow.
yeah, that is a wow.
The influence that had on the development of children and leaders,
Yeah.
young adults and leaders. Let's talk about the public health and the infrastructure that exists within your area. Can you tell us about the public health efforts that are going on in their community? We've mentioned some of these, but I want you to bring us up into modern times right now to talk about what's going on.
So you're talking about Millinocket specific, just right
Yeah.
here. Yeah, so I work for the hospital, and so my work is public health, and I sort of make the joke often that, you know, I'm the one, I'm the arm of the hospital. You know, it's one person grant funded at this time. And my funding has always pretty much dictated what I'm able to do in the public health work, you know, from the Healthy Maine partnerships, and that was, you know, around tobacco prevention, but it was also promoting physical activity and nutrition. You know, when that funding went away, and you were still there because you helped secure the drug-free communities work grant that we did. So it was around the drug-free communities work. And then once some of the funding sources went away and I got some other funding, you know, so that's been my lifeline is grant funds, you know. And so for the last 4 years, 4 or 5 years, I've had foundation funding, and it was to do aging in place work. So to connect the folks in our community that are aging or living with chronic disease to community resources so that they could age in place, staying home. So that's, I know that's like a huge movement. It might be called different things across the nation, but so for the last 4 or 5 years, I've been doing aging in place, aging work for our community. Um, and my current, so actually that funding has stopped, but my new funding source is foundation work, and I'm really free at this time. It's just operational support. So they said, whatever you were doing before, basically, you know, whatever that was, and it was working. And that was one of the reasons I got funded, I guess, you know, realizing the work that I was done had been doing needed to continue. And this particular funding, so the Sewell Foundation is providing funding to the Katahdin region in many different facets: economic development, community development. And so public health wise, it's around connecting our community members to resources to thrive in place. Most recently, I've sort of added, I had started a coalition at the beginning of the year until COVID hit, and it was around substance use disorder to try to get back to the substance use prevention work. So I'm a generalist. I don't have one thing that I'm working on. When I stop to think about myself, I'm not you know, I think of myself as a prevention specialist, but a generalist, and whatever the community needs me to work on.
It's an important role, and we can't underestimate the power that comes from granting organizations, whether it be private or public foundations, in order to develop innovative partnerships. Because frankly, there's just not because there's such a pull on the resources financially of a community, that public health often gets shortchanged in this space. You know, you mentioned aging in place, and you mentioned earlier about this idea that 36% of the population is greater than 60. What does aging in place mean to you? Can you kind of describe some of that to the listeners about this community?
Sure. So aging in place is something that a person can define for themselves. What does it mean to you to like quality of life, to be able to, you know, live out your life the way that you want it, and to have resources. So you think about, can people stay in their homes as long as possible? And obviously we have a lot of folks here in the community, like you said, they've been here quite a while and they still have their homes that, you know, from that they grew up in potentially. So how can we support people that are still living in their homes stay in their home as long as possible and out of institutionalized care? We're still working on like volunteer networks and our own little, you know, system in the community for like handy helper programs. So that folks, when they need something, you know, just small repairs that doesn't involve a contractor, that there's a phone number that they can call, a central place. And actually we're working with our library to be that resource hub and to have a resource navigator right out of the library. If somebody needs just, maybe they need their rugs pulled up, or rugs, you know, to a hand grip or something for their shower, whatever little things that might they might need to be able to stay in their home. Maybe they need food delivery. You know, we have Meals on Wheels program. We have our aging, you know, our Eastern Area Agency on Aging. Maybe we need to make sure that they're connected with the food program, and that that food gets delivered, or somebody does their grocery shopping and drops it off for them, and whatever they might need. Their transportation, you know, how do they get to their doctor's appointments? And so we're trying to look at any kind of resources that folks would need to be able to stay at home. We know a lot of our older people, actually there's not family support around because people had to leave. So there's a lot of older folks that live alone, and their children live out of town because they had to leave and they work elsewhere. I've received phone calls, you know, just as like, oh, what is there for programs in town? I live away, but I'm concerned about, you know, my parent that lives alone now. And so you know, I say all these things. We don't have everything in place. We're working on putting things in place, but those are all things we're thinking about, you know, making sure basic needs are met. The whole social isolation, you know, as a health concern, how do we make sure people are socially connected as well? So I don't know that.
Do you have an example of, and I think about this, where might be the leading edge? You gave us a lot there about the navigation and food and transportation and safety in the home, but do you have an example that we can pull from to say, this really is public health in our area?
So an example. All right, give me another leading question.
Talk about you and I have talked about the food in the community,
right.
and the need for food. Talk about some of that, about that infrastructure that needs to be there in order for people to get the nutrition that they might need to get through any given day or week.
Right. So so we do have local food pantries that are available in the community. So the food pantry is open once a week. Well, people have to eat every single day, right? Yeah. So, and there's so many people that won't go to the food pantry because they don't think it's for them. Or we haven't talked about this, just the shame and stigma of accessing community resources and that are for people that may need the help. So yeah, so around public health, we want to make sure, you know, some of the social determinants of health, that they get that people are connected to the resources that they need. We have the resources available.
I think
So, because if people, you know, when you connect it to people need to stay healthy, otherwise they're going to end up into institutional. They're going to end up in the hospital, and then, you know, or in the nursing home. If we want people to stay as healthy as long as possible in their homes, independent as long as possible. So it's, you know, public health is community health. We look at, you know, our community supports, our networks. We need to work together as a community to take care of each other.
There are so many ways that you could express this, and that probably wasn't fair because you're working in so many areas. You gave me an example last time we talked about one of the things that you were working on around sidewalks. Can you speak into that, about how that went?
Public, sure.
And what happened and where we are in that process, because it is public health because of the accessibility issue.
It is, yeah. So, so some of the work, a lot of the work is around creating the healthy communities, and we're looking at walkability of our community. And there is quite a corridor we call Central Street Corridor that leads to the grocery store that I live, my backyard actually faces that. So I see people on a daily basis walking up and down this busy street. You know, they may have kids or not have kids, or, you know, be alone, but they're carrying their groceries. So I have a huge concern, and like you said, for the infrastructure, that we need safe walking routes to food sources. And so we brought that to our age-friendly communities committee. part of the municipality. We have an age-friendly communities committee. And so we are looking at, again, we're in the beginning stages, but I'm creating a lot of awareness around it, that we need safe walking roads to our food sources, whether it be to the food pantry, or we have some small general stores around here still, or if it's up that corridor to our Hannaford, into our drugstore.
What's the process in order to make that happen for you guys?
Well, because it's part of, we have to go to the DOT, that, you know, our State Department of Transportation. And so, and we actually have a state resources. The Bicycle Coalition of Maine will do, you know, just walkability, they'll do assessments. And so I'm in contact with them to come and do a walkabout with us and like look at this area and give us some suggestions on how to make this roadway, this street safer for pedestrian traffic. So we're working with some partners to look at that. And like you said, it gets right back to like, you're taking me there, David, the whole assessment to see, you know, to lay out assess the situation, and then to look at what some of our solutions might be, and might try to do a demonstration project or two. We've got some funds to do that, but.
So the work you're doing is no different than people are doing across the country.
Absolutely.
About getting people together to understand the needs of that community in order to make changes that will benefit the community. You mentioned this age-friendly committee. Talk to us about that. Who's on that? You are.
I am. Yeah, so about a year ago in April, the town actually, we applied to the AARP network of healthy, network of age-friendly communities. And so what you do is you apply, and there's an application process, and then you're accepted into the network. So it isn't that you start off or you say that you're age-friendly, it's that you will work towards becoming more age-friendly. You have to do an assessment of what you have available currently, and then, you know, have some goals, and later submit a work plan of what some of the things you'll do to make your community more age-friendly. So that opens up the door to some resources for us as well. And so that's, you know, a big piece of this work, besides just working on a community coalition level, bringing, you know, all the groups together. Now having the municipality as part of the coalition, you know, is a big step, and it's is beneficial, obviously, because a lot of times you can't go after funding unless you're part of municipality, and obviously to change roadways or walkways, or, you know, to get help, that's got to come through the municipality. So we have members, town council members, that are on the age-friendly committee, as well as myself and another coworker and a couple community members. So that's fairly new, but I look to have that grow.
What's been the response to the community to this designation and to this membership?
It's been very positive, because I've been able to continue to show them that we have, you know, it opens a door to other resources, and plus in just the comprehensive plan for the town. Yeah, it ties into the work that they're looking to do around economic and community development. So it's another piece of the pie, and it's great to have somebody else, you know, sort of lead the charge, community member, lead the charge. So it's been very rewarding to me, and I know it's a mutually beneficial relationship.
You know, I was on a call this morning, Jane, where we talked about the proverbial silos. And I think sometimes people are so busy and so full of their own stuff that they don't recognize when there might be an opportunity for synergy. Why is that, even in an area like yours, that this happens, where everybody knows each other, but nobody knows what's going on?
Your guess is good as good as mine, because everybody assumes that other people know what's going on. Like they'll think, oh yeah, I put that out there, you know, or it was in the paper, or it was here or there, you know, how come you didn't know about it? And yeah, we've been working, you know, since you were here, that was been part of our conversation since we started this. We need to break down the silos. We need to work together, collaboration. Obviously, any of the funding opportunities that we go for, they want to know how you're collaborating and that you're not working together. And funding opportunities, you know, actually demand that. They insist that, and, you know, and for good reason. I think that's how you're going to get the work done. If you're building relationships and you're working together on.
So I want to ask this because it fits in with the work that we're doing here around this show. You've got this infrastructure and these committees and these things that you're working on. How does that impact chronic disease management? How does that all fit together on this piece of the puzzle? Do you have ideas on that? Especially diabetes and hypertension.
Yeah. So I don't think it's overly evident to folks how it all connects, but we know if we have walkable communities and places where people can get out and walk, then their health, you know, there's opportunity for health improvement or to stay healthy or to keep their health, because physical activity is so important. You know, you talk about chronic disease management and diabetes prevention. I do lead a diabetes prevention program for the hospital. And physical activity is a huge component, you know, of that. And so I'm always working to promote, you know, any type of opportunities for physical activity and for people to stay healthy, and recognizing, you know, that's an opportunity for prevention. It's tough when you talk about chronic disease prevention, because that's not like sort of a lay term. I guess you think about, you know, what does that mean to people? We see people like at the hospital after they've already been diagnosed, and, you know, now what do I do? And even people in the diabetes prevention program, there's some people that have already been diagnosed and they still want help, you know, they want help and the support of others as they're trying to make their lifestyle change. We no longer have a cardiac rehab program. So when you talk about some of those programs, the disease management, that actually it's been over a year. We don't have that program. We didn't have enough people enrolled, and you know, it wasn't, when the hospital had to make cuts, it wasn't cost effective. People were canceling their appointments. So we've got a lot of work to do. I'm not sure I have a lot to tell you or share with you what you might be looking for.
Well, you know, when we talk about the idea of cardiac rehab, we're really getting into the idea of tertiary care with advanced disease that have a great deal of cost to it. I want to go back to some of the basics when you talked about walkable communities, and you've been in this for a very long time. Don't you think everybody knows by now that physical activity is good for you in preventing chronic disease? Is that something we still need to push on?
I think we still need to push on it. It's
more.
interesting. You know, it's interesting because I think about this all the time, even when the small cohort for the diabetes prevention program, and it's like, you know, 30 minutes a day, 30 minutes, 5 times a week, the minimum CDC requirement's 150 minutes. People have a hard time getting it, and I think it just has to do with behavior change because they haven't done, it isn't something that's part of their lifestyle. It's a lifestyle change. So I think we have, how sedentary, our community members are and the obesity rates here. So yeah, it's interesting to me that we've got a lot of work to do to turn that bus around. And you understand it has to do with behavior change and how people fit it into their day-to-day lives, and get people to eat well and stop using the microwave to cook all their meals, and the fast food industry. That's a whole we got a whole series on that. I don't have any answers. I just know behavior change is really, really hard. And I have people.
Go ahead.
No, I have people. We've been doing this diabetes prevention class, and I have a cohort that starts like every year, and I've had people come back like 3 years in a row, just because of because of the support, just to be able to stay on track. So it just reminds me that we need to have, ongoing classes all the time, even after people sometimes reach their goal, in order to stay at their goal and to stay on track. It's even after, a year, they still need support. So until it becomes part of, people find value in doing it every day, carving out time in their day to do it. That's your neck. Yeah, that's your specialty. Figure it out and let me know. Bring it to Millinocket.
You caused me to be guilty, because even my terminology, now we're in the business. So we're in the business of chronic disease management.
Yeah.
But for those who are listening, they're going to go, what is Nelson talking about? Because it's like, we don't use that terminology. And hear somebody say, I got the sugar, right? And so it's like, no, you don't have a cup of sugar. You got type 2 diabetes, right?
Right.
And we still are struggling with that, 30 minutes a day to walk in communities. And I think also there are pressures now economically, that people are doing the best they can with what they have. But you highlight something that I want to talk about, because we talk about this. This is a lifelong thing we're talking about, right? Talk about the lifespan in this efforts. You've done work. You're trained as an early childhood in public health. You've done work with children. You've done work with adults. Talk about the lifespan of the issue around how we think about the health of the community.
It goes back just to the message of prevention that we have to start, at a very, very young age. So people are used to, that becomes a lifestyle, so that it's second nature, so what families feed their children from day one, that it isn't the fast food stuff, it isn't going through McDonald's, and that they do go to farmers markets, or when they go to the grocery store, they're thinking about building their plate around fruits and vegetables and whole grains and stuff. So to me, we absolutely have to start, at the beginning. And, when women are pregnant and prenatally, that they're eating right. And, that's a great time. A lot of people are thinking, I want to, take care of my baby, before it's born, and they take care of themselves. Then we got to make sure that they continue once the children are born, to give them those healthy foods, so that their palate, so that tastes good to them, and not something foreign when they're introduced to it, at a nutrition class at school in 3rd or 4th grade, and the dietitian comes in, and because there's this great program that's brought to the school, and who's tried a kiwi, or some other vegetable or fruit, you know what I mean. So
I do.
So when we talk about it, everything needs to start early. So we have to have a concentration on, early childhood, right out of the womb, as children, as babes, as they grow, and so that it becomes second nature. It's not, it's not questioned that when I go to the grocery store, of course I'm gonna look for a whole grain bread and not just but then it becomes an issue of affordability. So that's another whole conversation, because everybody said it's so expensive to eat healthy. So then there's another challenge.
I'm going to ask a question, because one of the things that we're seeing in the U.S. is this idea of equity, right? Not that we're spreading resources equally across, but where we need to put additional resources to give support to those who need it most. Do you have a sense of where equity needs to be built, or in your community, for the health of that community?
I say yes and no. As I had mentioned, our community culture has changed, and we have a lot of folks that are, living day to day in the crisis of poverty. So, I want, I, like you said, equity. I want opportunity of those that are living on that end of the spectrum. I don't know that answered your question, but it is something that I've been thinking about a lot, but I haven't tried to operationalize it like, you're asking me to.
You've identified it already, in sense of those people who probably struggle the most, that are living day to day, and that survival is literally not guaranteed. Um, it's tenuous, whether it be because of economics and they've lost hours, or you fall and break a hip and you don't have the coverage. Even if you have Medicare, you don't have the coverage because you have a $2,000 deductible. You could be homeless as a result of that. And so thinking about that structure, maybe where, and it's perhaps as we go forward, there might be different pockets. There could be some children who are not thriving because they don't have enough. At the other end, there are seniors that are not thriving because they don't have enough.
I totally agree. And then you've made me think of another pocket. We have a lot of folks in our community struggling with substance use disorder.
Talk about that.
And so, no different than across the country, the opioid crisis, but also, just alcoholism and fortunately, actually, it's been our recovery community that have stepped forward and have like formed some supports here. We have a new recovery house that's opened up called Breaking the Cycle. So it's a recovery home for women. And we have peer-to-peer. We have another group it's like a drop-in center for support services and for meetings. And so as I had mentioned earlier, we had just started sort of started coalition and trying to bring folks together, started meeting like in January at a physical space, and that had to change. But we have a huge need here, just like across the country, for services. And that's something else that I don't want to say I'm working on, but I'm so concerned about. Yeah, and if the least I can do is build coalition around it and bring people together. And
well, I think there's great value in bringing forth the infrastructure on how to do that, because most people go oh, everybody knows how to exercise. No, they don't. Everybody knows how to eat healthy. No, they don't. One of our shows was on plant-based diet, and the physician reminded me that so much of the food that we eat, it has added sugar in it. And now I'm looking at all the added sugar that is in food, and it's we want to talk about obesity. Let's look at the added food in the sugar. Absolutely. But people need to know, and they need that person to do that. Jane, I want you to talk a little bit about what's something that's coming up in early November that you're going to be doing. What are you doing? What else are you doing?
Oh, yeah. So I'm running for town council. Yeah. So I'm going to give it a shot. I figured the work that I do in the community, so linked to community economic development, it would fit nicely. It would take me to that next level, hopefully influence policy, create change, be a voice.
I know that space because for
the
listeners who aren't aware, I was a town councilor in the town of Millinocket. I was the chairman. Sure. One of the members called me the de facto mayor of Millinocket. Yeah. So I don't get introduced so much anymore as that, but I was, and I think I agree with you on that. It's another way to speak of and speak into the pieces of the puzzle and to connect the pieces. Jane, I want to ask you one more question, and I want you to think out 10 years from now. What do you see?
I see a vibrant community here again in 10 years. That will be the time span that we need to get that, the mill site rebuilt, so some economic vitality back. I see potentially daycare center. That's been something that we need childcare here. We don't have that here. I think a renewed hope. I think through we're going to have more walkable communities, opportunity for people to get out and walk and make that more of a norm. So maybe this is all pie in the sky sort of thing, but just, it's just the optimistic look that we're on an upward trend, and it's pretty exciting to be part of this community. I think we've got some of the tough times behind us, and we're moving forward. You had mentioned when you think about physical activity and even just starting to read labels again, people want structure. It's like, oh, if you have a class or you have this, let me know, I'll go. You did that when you were here. We had the community walking program, Yeah. Doctors Nelson, you guys both showed up and led led walking through the community. Those were hugely successful. So it's structure. People like need structure, need to be told, and they'll show up. So um,
They showed up year round. We would walk into school in the winter, and we would walk outside in mud season. And, you know, even when there was mosquitoes and all the other bugs, people would show up because, you know what, we were invested in it.
Exactly right. So I see hope. I see, you know,
I am so glad that you said that, because I tend to fall on the optimistic side. It can be easy to get down in the politicization or in the current issues like the pandemic, but we have to look to where there might be the assets, which we've always done, but we also have to look to the people and the history of the people that, as you said, were resilient.
we are, yeah, and I'm going to say that because I'm from here and I can say that. We are resilient, and you know.
Jane, anything else you wanna tell the listeners today?
That I miss you, and that I wish you were in Millinocket. I wish you were still here, being the mayor of Millinocket, right, helping us lead this through this this time. But no, I appreciate this opportunity. And I owe it. You know, I'll say it. I owe it to you that I got into this public health field, and it's been a rewarding career. And I look forward to aging in place right here, I think, in my hometown. And
You know, you are an inspiration, because sometimes it's hard to put a handle on all the things that you do and we do in this space. And you said early that we are generalists. And, you know, family medicine, my wife's a family physician, and I think it's the hardest profession to be in, because you literally support people from birth to death. And I think public health in a rural community can be seen in a similar way, where we literally have our hands in multiple things to both give support, to give insight, to think about how the pieces might connect. So Jane Danforth, you are an inspiration for others to follow. And if any of our listeners want to get a hold of you for any kind of consultations, what's the best way to do that?
it can be through my email or my phone number. Do you want me to share that, or will you share
Give
it?
your email out to our listeners.
So it is J Danforth, so my name, JDANFORTH at mrhme.org, mrhme.org, and that's for Millinocket Regional Hospital. And my phone number, 207-723-5288. 207-723-5288. Thank you.
Jane, you are a joy, and I just adore you and your family and the whole community. Please give my best to everyone. When this comes on the air, we'll make sure that you get it and you can share it widely with your new constituents about what the great things you're doing. But I hope sometime we can follow up with you just to have another conversation, because we need to have more discussions around how we support our communities that are not in our major metropolitan areas. And they too need support from a public and from a holistic perspective.
Thank you, David. Yes, please stay in touch with me. And I'll reach out
Wonderful.
to you if I need you.
Absolutely. Wonderful, Jane. Thank you so much.
All right. Bye-bye.
Wow, that was a lot of fun. I not only got to catch up with an old colleague and someone who I just think the world of, but I got to learn something about public health and the way we look at our communities. Jane mentioned, as a lifelong person in her community, that it's important to know the community and know the people of the community, the culture of that community, as well as knowing how to get things done. She spoke of the decimation and really the disinvestment in her community, of going from 12,000 people at its heyday down to about 4,000 in its current iteration. She also mentioned this idea of the continuum from issues related to early childhood to issues related to senior citizens. Not similar, not dissimilar, not all that similar, but at the same time, it's the continuum life on how there is a need for greater sense of infrastructure. She also mentioned the people and the people that she works with. And I think that's an important thing for those of us who think about community engagement, how we need to be out in the community with the people that we care about. It was a joy to speak with Jane and to get to know her and to let you get to know her, as well as her to share about the community. I hope if you have comments, you'll send comments around Days of Learning. And I also hope you'll subscribe. And it's only through your support that we can continue to grow this. For Days of Learning and for Medical College of Wisconsin, I am your host, David Nelson, and I thank you for your time. God bless and continued health to you and yours.